Chiropractors are the most educated doctors when it comes to lasers. They're also the most frustrated. Why? Well, as early adopters of the technology, they've been promised both clinical and financial benefits that have not materialized. Doctors who invested in Class 2 and 3 lasers soon realized that these were too weak and treatments were too superficial to create results when treating deep musculoskeletal pain. Because of this, doctors wouldn't treat a patient with a Class 2 or Class 3 laser as a standalone treatment. Instead, they'd end up bundling the laser treatments with other modalities, an adjustment, the laser treatment, rolling table, and/or massage, never sure if the laser was creating a benefit for the patient. Since neither the patient results nor the financial results were achieved, many Class 2 and 3 lasers end up in desk drawers. Other doctors invested in Class 4 lasers as they have the power to create results for patients with deep-seated muscular pain. Yet these lasers carry additional risk as that increased power also brings heat and the risk of thermal damage. This creates an issue. Does the doctor have to operate the laser to minimize risk and liability should a staff member burn a patient? If so, the doctor is now tied up when they could be adjusting multiple other patients in the same time frame. If the doctor delegates the staff to do the treatments, they have the nagging worry of the thermal damage and the cost to reputation and liability with every patient. Eventually, they realize that the most expensive part of a Class 4 laser, beyond the risk, is the cost of the staff member providing the treatments. These are just some of the limitations that have frustrated doctors, and is why the robotic MLS laser is the #1 laser that doctors, who already own lasers, will upgrade to. You see, the MLS laser is the only Class 4 laser that does not create heat or risk of thermal damage. This allows the MLS laser to be the only Class 4 laser that can be robotic and treat patients in an unattended manner. There's no staff needed during the treatments. So the risk of thermal damage and the need to pay someone to provide the treatments is now eliminated. You or a staff member can just choose the treatment, aim the laser, and then set it and forget it and go back to whatever you were doing. You can adjust a patient or two in another room while the MLS treats a patient with an 85 to 90% efficacy. This high efficacy means it's a true standalone treatment, allowing you to treat new patients from the larger community who want pain relief but don't necessarily want to be adjusted. The high efficiency means better patient outcomes, and the happier the patient, the more willing they are to pay for the treatments. All of this means that doctors can finally have a laser that provides the patient results and the financial benefits that they have been looking for. Heck, 22% of our doctors end up owning more than one robotic MLS laser in their practices. Let's schedule a time to discuss how the MLS can grow your practice and add an extra $50,000 to your annual income. Until we talk, here's to your continued success. Take care.